Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this wonderful Wednesday morning when it's actually not raining. What a great day. We are delighted to be here with you because today marks our 300th Morning Media Update.
Wow.
You know, it's kind of funny because I have to say that is really cool that we're having it. It's really a sad statement. We have to have a 300th episode about COVID. In fact, people come up to me all the time and they say, hey, thanks you for doing that. I'm like, I really wish you didn't have to watch me because what a terrible thing that we have this whole crisis out there. I do know that, who are those guys sitting next to each other and talking like, have they not heard about the CDC guidelines
There wasn't
here?
well-known.
What was going on right there
at that time?
What were we doing?
There's a date line up there.
My God, it could have been. I think we're within 3 feet.
Yeah.
Was that the guidelines back then? You won't spread COVID if you're within 3 feet. You're too close. I think that's probably the rule.
Well, to be fair, we didn't have a lot of information from the place of origin of really what to do.
I think maybe that's the answer. But 300 is a big deal, and I'm not talking about the episode of Star Trek that I've watched, 300 straight episodes without interruption, nor am I talking about the movie 300. We're talking about 300 morning updates here. I always want to say medical, morning media updates around this crisis that we call COVID. And it has been our absolute honor to serve you and to serve our area and our city and to work with an amazing team of people who you don't see. You hear Jill's voice a lot, but Logan and Anthony and Cliff and all the other outstanding individuals who make this program run and spend hours and hours and hours making sure that Hawkeye and I can look good. And for Hawkeye, that may be easy. For me, it takes a lot of buffing. And those guys, they have to work really hard at it, and we really want to say thank you to them. So it's a big deal. It's quite a milestone. We actually have a really special guest here today. You all know our psychologist here from the health system, Greg Nawalanic. He has been here before with us, including back in the early days of this program. So, Greg, thank you for coming back. Welcome back, and thanks for your steady voice throughout this pandemic. And we're especially grateful for Olivia Ashbrook, who is a patient who Dr. Nawalanic has worked with about feelings of anxiety. We're going to hear their story in just a moment. It's a really important story for us all to hear because I know there's anxiety about going back out into the world as COVID begins to ease. So, Hawkeye, are we still easing?
Yeah, I think so, but I don't know about looking good. You know, certainly Logan and Anthony help, but I seem to remember right before the show, somebody said I looked like I rolled right out of bed.
You did look like you rolled out of bed. But then you did what I do. You combed your hair. Okay, I'm ready. Let's go.
I made my kids breakfast, made my kids lunches, had a meeting with the ICU directors and Dr. Castro and Satterwhite and Norman, and so I've been busy.
Okay.
I just haven't had a lot of coffee. That's really the problem. We need
Not enough coffee.
I've had just a couple sips. So the numbers are still good.
You look simply marvelous.
We're trying. I'm trying. Hopefully there'll be more sun and maybe we can get a little bit of
vitamin D.
Yeah, vitamin D. Hays has 1 active and 2 in recovery, but I think the story for here is we have a couple more active infections than we did yesterday. We have 7 total infections, but only 1 of those are symptomatic.
So the rest are really asymptomatic screenings.
Yes.
Yeah, isn't that interesting? We're seeing the screening. The screening is positive whether you've had the vaccine or not. Again, we think fewer people are positive because they've been screened if they have the vaccine. But the reality is you can still be positive. You're just asymptomatic.
And that person that is symptomatic is not vaccinated.
And they're in the ICU.
They are. So we do have 4 total vaccinated, 3 unvaccinated. But again, 6 of those 7 active infections are asymptomatic. Only that 1 that is unvaccinated is symptomatic. So again, I think vaccines work. And
clearly.
Continued evidence of that. And then 10 additional, so 17 total patients here.
Yeah, 10 additional, the ones that are recovering.
Yeah, the recovery. Yep.
And again, we just harken back to our CMO call on oh my gosh, what day was that today? I guess that was Monday. Right? Yeah. And it feels like it should be Thursday this week or already Friday. I don't know. But I think that what we learned on that CMO call is that the numbers had actually slightly ticked up from a real low last week and ticked up. So that's a trend we have to keep an eye on. Certainly don't want to sound any alarms around it because it's still really low numbers. In fact, across the United States, the numbers are as low as they've been since last April. April. I was looking at the New York Times graph today. The number of hospitalizations has also dropped significantly over the last 2 weeks for the rolling 14-day average. And that's across the country, and it's also true in Kansas. And so I think we just have to recognize that hospitalizations per 100,000 is still quite low from COVID-19, nowhere near as high as what we were when we were at the height of the pandemic in November, but still too high, and still something we need to take very seriously as we work through trying to make sure we get people vaccinated and end this thing altogether so that we can all be safe and all be unmasked when we go to places like Arrowhead and Royal Stadium. Also stuff coming out over the last couple of days about the risk of infection and the percentage of the infections that are really serious coming from outside sources versus inside sources. I think the CDC, head of CDC was testifying before Congress and said there's been some recent data suggesting that it was less than 10%. Then when you go look at the review article that talked about that, they're really saying that there was one study that hit around 10%. Most studies showing that maybe 1% or less than active infections are from outside sources. Really, it's all about being, if you can be outside, you're safe. And when you're inside, if you haven't been vaccinated, you really ought to still be masked. Yeah,
and I think we kind of saw that anecdotally last Memorial Day, but now we see this guidance coming out. But again, I think vaccine has an extreme impact on that as well. But overall, we had always really advocated for doing things outside and getting outdoors rather than indoors as well.
Yeah, so darn important. All right, let's see if there are reporter questions out there this morning.
Good morning, Cody Holyoke from KMBC 9.
Cody.
Hey, guys. I know it's safe to say vaccination numbers are not where you would like to see them. And I had a friend ask me yesterday, kind of sarcastically, like, what else can we do? What else can be done? At this point, how do you change minds to really tackle the vaccination issue?
I think the answer is, and we'll talk with Greg about that in just a moment, but I think the answer, the next big step that we can make is, I think when the FDA approves Pfizer and Moderna vaccination. I think when that happens, and then the J&J, when it's just they're going to be a little later because they went into this a little later, but I think when those vaccinations start becoming FDA approved, I think we're going to see some groups suggest, and businesses and others suggest, and I know we will, I think we'll, at least likely will, that we'll be saying, hey, our employees need to be vaccinated, just like we do with the influenza vaccine. Now, what we don't want to see happen is for this to become incredibly politicized, and it already has been. I mean, I think one of the frustrations of the U.S. response is we politicized our response as opposed to, I don't know what the right verb there is. The opposite of politicalization is doing the right thing and not politicize it. But I know that some legislatures are veering into healthcare and saying, we're going to tell you you can't require it. I struggle with that because I don't think legislatures should be trying to dictate the standard of care and medical practice. I think that belongs strictly in the hands of those of us who do healthcare on a regular basis. And I don't think that legislature should substitute medical judgment in that setting. But I think that when we start seeing it become an FDA-approved drug, I think that'll help people feel like it is a little bit safer. And I think as time goes by, I think we'll see it be safer. And I think as time goes by and we see more of the people who are getting sick and infected and coming in the hospital and dying from COVID-19 being those who are not vaccinated, and those who have been vaccinated having a much safer return and a much more healthy return to regular life, I think that will drive the change. So I think over time, we're going to see the anxiety lessen, the politicalization lessen, and good health care take effect. And so I'm going to turn to Greg and see what your thoughts are about that question.
Well, I mean, as I'm thinking about it, the first place my mind goes is to our work that we've been doing in the long COVID clinic that's been established here. And I've had a large number of individuals who, when they had their acute infection, very few symptoms, just loss of taste and smell. So almost asymptomatic infection at the acute stage, but now are having more significant sequelae down the road. And so for the people who might think, oh, I don't have, I'm not going to get that sick. It's not that big of a risk. So what's the point? It's not about the acute infection that we're really worried most about, at least from where I'm sitting. I'm seeing people who are having significant depression and anxiety as a result of the brain fog, the exhaustion, the fatigue, the different symptoms, and even some cardiovascular and pulmonary issues that have come along, and other neurological issues. So this is not as simple as getting over the acute hump. There's more extended risk in a large number of populations. So I think that allowing it to be politicized is just completely irresponsible and inappropriate. But it's something that clearly we see, and I think that as the mask mandate has been, peeled back, I'll tell you that one of my concerns I have when I'm out is my wife, we still mask, and I see almost a challenge that I get from the people who aren't masked. That it's like, and I have a really difficult time with the fact that I feel a lot of these people are the ones who are not going to be vaccinated. They're taking advantage as like a wolf in sheep's clothing. It's like, oh, I'm not wearing my mask because I'm vaccinated, when of course they are not. And so it's really setting us back from the progress that we've made, or it stands the risk to set us back. And so it's about trying to stay informed, recognize that it's more than just that acute hump. The long term, the long COVID is a significant problem and a significant risk that we need to consider.
Yeah, I think that's exactly right. And I think that the long haul thing, we keep talking about it, and there are a lot of people who have it. And it's unfortunate because it's so truly avoidable. Mm-hmm. What are your thoughts about the next big thing here, Hawk, to try to get people vaccinated?
I think it is going to be a multi-pronged approach. It is, continuing to promote the science and data about the safety and efficacy of it. But then it's, as we said before, it's then being able to also talk to trusted people, whether that's your primary care physician, your pastor, other people that you know and trust. I think that's going to be important. And then I think maybe one of the third steps is when you start to see private entities mandating vaccination for one way or another, a vaccine card or something. So I think, there are other things in there as well, but those are, I think, the main things, and we'll continue to see that. I think we are already starting to see benefits for people that are vaccinated, particularly for travel. You're going to be able to do a little bit more and maybe not spend time in quarantine, things of that nature, if you're going to destinations. So I think it's going to be that multi-pronged approach.
So I think it's been said now that 50% of Americans eligible Americans have had one vaccination.
Mm-hmm.
How many deaths have we had from vaccination?
None.
It's said now that about 30% or so of Americans have had COVID-19. How many deaths from COVID-19 have there been? 600,000 in the United States. So let's think about that. 0 or like less than 10 or whatever the number is from vaccination. 600,000 from COVID. The math is clear. And I think what we have to do is follow the math, follow the science. We've said all along, faith, hope, science. The missing part in our equation now is you. We can end the pandemic, but it takes all of us.
And I would just like to follow that up with, the VAERS, the Vaccine Adverse Events Reporting System. People will present to us data and say things, no, you're wrong, there's 3,000 deaths due to the vaccine. We should also note that in that VAERS, all of those reports are unverified and unfollowed up on. In fact, I think one physician had put into that reporting system that after he got a vaccine, it was turning him into the Incredible Hulk. So just to understand that, yes, those numbers are in the VAERS, but those are unverified reports. They aren't able to track down what that system is.
You're saying I'm not going to turn into the Incredible Hulk?
No.
Wow. That was my hope.
Would you report that, though? I would keep that quiet.
If I could actually get a biceps,
because you don't want other people to do it.
I might get a biceps. If I could get I could do that, I might report that.
Okay. So
I don't think it's true, though.
Right.
Yeah, that's a problem.
So just understand that those reports are unverified. But what that is to do is to look at larger signals of problems and issues. So.
Yeah. Folks, we just do this every day, right? We do this every darn day. We give influenza vaccine, we give MMR, we just give vaccine all the time. We've given 45,000 people vaccination. We've given over 90,000 doses or thereabouts of vaccination. People aren't dying or getting terrible side effects from the vaccination. Those stories you read on the internet, they are a hoax. Because we have promised you no flapjacking. We don't flap on our arms and we don't jack with the truth. And we're not doing it, we haven't done it all along, going back to that very first picture you showed us and the original thing where we were all huddled around that telephone with Hawkeye and I, violating every principle of infection control, which we freely own right now. But we didn't jack with the truth then, and we're not going to jack with the truth now, and we're not going to lie to you. And I'm just telling you, when you read these internet stuff about people dying from the vaccine, it's a hoax. The reality is over 1 billion doses have been given worldwide. Over 1 billion. And here in the United States, maybe a third of our country has had COVID-19. And 600,000 have died from it. The math. Follow the math.
And I would say, look what's happening in Japan right now, where they're actually a larger call every day to cancel the Olympics. And of course, look what's happening in India. But also, to that point, we know that the CDC now has stopped investigating routine breakthrough infections from the vaccine because there have been so little. I think they are just moving to investigating hospitalized patients with breakthrough infection.
Okay, Cody, that was really long-winded. Probably that may set our new record.
That.
We may set a new record with that question, Cody. Did you have a follow-up? Are you still awake? Are you asleep? What's going on out there?
Oh, hold on. Yeah.
We're just trying to impress you.
No, I appreciate it. But I'm curious, and I haven't heard a lot about this, and I don't know if the numbers will show you this right now, but are you seeing more middle-aged adults or younger people not getting a vaccine? And obviously, you know the numbers of people who are getting vaccines. I'm curious if there's an age group that needs to be targeted more.
Tune in tomorrow. We've got a graphic. We're going to show you the data exactly for what age groups have and have not been vaccinated here in the health system. We got that last night. I sent it over to Jill about 11 o'clock p.m. And I think you'll see the age breakdown of who has and who has not been vaccinated. And it's kind of what you would expect. Those who feel most at risk are the most vaccinated. The young people who have been a little less, felt a little more immune, have not been vaccinated as much. But we offer it to anybody 12 and over, and I think that's the FDA stuff now, and that's what we're doing. But you'll see the exact breakdown tomorrow.
Okay.
Other questions out there? Jill, I think we need Cody on the show sometime. I think he needs to come on the program because he's been with us so long. He's asked such great questions. We'll talk about what it's like to be a reporter during the pandemic.
We will ask him if he can be allowed to do that.
He may not. That may be crossing boundaries, right?
It could be, but I don't know. We'll ask we'll have him ask his news director. Maybe we could have several reporters and make it a panel.
What a hoot. What a hoot that could be. All right. Cody, we're talking about you. Sorry about that. You and Taylor, you're always out there. All right, so listen, let's start talking with Olivia, and let's talk with Dr. Nawalanic. First, I want to welcome Olivia. Thank you for sharing your story today. Tell us a little bit about what happened. Talk to us about you and anxiety, the pandemic, and how you got to know Dr. Nawalanic. You got to unmute.
Okay.
I think, gotcha, you're there.
There we go.
Awesome. I do that all the time still. I am Zoom deprived.
Anxiety is something that I personally have dealt with my whole life before the pandemic. So I'm someone that will worry about everything. I have racing thoughts that keep me awake at night, and I'll have panic attacks. One time I called my mom and thought I was having a heart attack, but I was having an anxiety attack. So when the pandemic happened, I knew for myself that my mental health was going to probably be affected pretty significantly, especially because I was already worried about getting sick on a normal day. And then my mom's a nurse. My family has health conditions. I'm living alone. That was kind of tough. I'm still working at home. And we were living through a historic event every 6 minutes, it feels like. So that was nerve-wracking as well. And at the time, I don't think I really understood how much the pandemic was affecting my mental health until I started trying to do something to help it.
That is a really well said thing. Talk to us. What do you think about the pandemic affected your mental health? What was it? What was that connection like?
Well, I think that I'm someone that really has a hard time sitting with how I feel or things that are going on. I like to keep myself really busy. And so the pandemic was something none of us could get away from. I had to sit still and figure out how to deal with things that were causing me stress. I couldn't just run away and go do something to distract me. So I think that was something that was really tough for me. And then generally, I haven't been around people. I live alone and I work at home alone. I'll Skype my coworkers, but it's hard to be isolated for a year. A year is a long time.
A year is a long time, isn't it? Oh my God, that is so true. You know, I think some of us in the health professions, I mean, we're working every day. We still came in, we saw people masked, but it's not the same. And I can't really imagine how hard it was to be in a situation like you've just described, where you live alone, you work alone, and you're by yourself all the time. That's really hard. What made the decision, or why did you make the decision, and when to seek professional help?
So I will just say that I have pretty much neglected my mental health my entire life. And I had done some really intense schooling with a schedule that would probably make anyone anxious. And so I had let my mental health slip during that period. And that was about a year before the pandemic. So I had been thinking about trying to find someone to talk to and figure out what I could do to help myself. But I'm more anxious than I've ever been. I was more depressed than I've ever been. And I felt like both of those things were running my life. And I was tired of feeling like my whole life was a crisis. And so it took a lot of effort initially, but I decided to call HaysMed. And then throughout that process, I got connected to Dr. Nawalanic, and things have improved.
Well, that is great. Tell us what Dr. Nawalanic did, or how did it help? What happened that made it such a difference for you?
Well, I think acknowledging that I needed to work on my mental health was a big thing, and I think that might sound kind of weird, since it's like I called him, so I knew that, but I don't think I knew the degree of work that I probably needed to do for myself. But I needed to learn just basic coping skills. Like 1 week, he told me to learn how to take deep breaths, and I looked at him and I was like, please don't say dumb things to me. But it really, just little things like that, they really helped me a lot.
You mean a doctor's advice actually worked?
Yeah, surprising to me too, but it turns out that medical professionals know what they're talking about. So.
Sometimes.
Yeah.
You know, I like to give Greg a really hard time, but obviously he's one of the best at what he does, and that's why we love having him on the program. But your story, I think, sounds so familiar, and I'll be honest, I've had help for anxiety too, and it does make a difference in your life when you get that kind of help, because you're right, you just get sick and tired of being sick and tired, and that's kind of a driver for you. Or you see how it can run your life, or it may run the life of your family or your loved ones. It affects a lot of people when you're affected like that. Tell us about what kind of work you do, and what was your school studying in that made you be pretty intense about that? Because I bet there are other folks out there like that.
So I went to architecture school. Everyone jokes and calls it architorture, which I think is pretty accurate. It's kind of a game of who can last the longest through not sleeping, not really taking care of yourself, getting work done at a pace that no one really should move at. And it was for 5 years. So that is a long time to really just, I watched my mental health deteriorate.
Yeah.
Yeah.
No, I get that. I think you architect types, that's a pretty hard profession. I know I'm trying to do a little work on our condominium now, and we have an architect, and he's great. He's been with us. I don't know why he keeps coming back and working with my wife, and I think we're probably driving him crazy. But he does just a great job. Craig Shaw, and a wonderful person. But I'm sure he probably has a bulletin board or a dartboard in his office that's got my picture on it. So, yeah. So, Greg, talk to us a little bit about what was going on with Olivia, and how common is that level of anxiety?
Well, I mean, it's extraordinarily common. I think everybody, to some degree, if we think about anxiety, we have to consider it along a continuum where some folks have what would be an appropriate level of anxiety where, you know, you have a deadline approaching, you get a little activated, and it kind of helps you get aroused to meet the deadline and meet the goal and get your work done successfully. Then
You
there's
mean those of us who are especially who may just be that kind of person where we, what's that called, where you, procrastinate.
Yeah, those.
That's
And so that's like a self-imposed anxiety where you make choices, you know, and it's like, all right, risk versus reward. I can just continue eating a bag of chips, watching TV, and just put off the work, and then it gets too late. You go say, I'll do it tomorrow, and you just keep waiting. And then eventually it all piles up. And whereas if you'd just done a little bit along the way, your anxiety level would be far better regulated. And then that anxiety continuum goes to the extreme of folks who don't even want to leave their home. Any idea of anything that they do becomes really panic-stricken, and eventually they get to a point where they don't even really need a specific stimuli to fear. They start to fear the anxiety. So it becomes a self-feeding animal, and it gets harder and harder to get out of that cycle. So if you take someone, particularly like in Olivia's situation, high-driven, highly successful individuals, they get kind of primed to, you know, try to chase the excitement of I've got a deadline, I got to get this done, that challenge, and wanting to succeed and just always be the best. And, you know, I'll blow her horn. She's won awards. I mean, she's celebrated what she does. And so eventually that kind of the bloom comes off that rose, and you're left with just this tension cycle where you're kind of constantly racing through to whatever's next or just trying to fill voids. And I think that when we think about our body's messages to ourselves, I liken them all the time to dashboard lights in a car. And we're really good with the more specific ones, like, you know, low tire pressure. Okay, I know I've got to put air in the tire. It's a given. So that's simply similar to like hunger or being tired. We know what to do about that. Anxiety is like the check engine light. You have no idea what the hell that means. But you know that if you ignore it long enough, you're heading towards a breakdown, and that will occur. So you kind of play this negotiation of, okay, the light's on, but I've got all this stuff to do, so I don't know that I necessarily want to take my car to the garage, have to deal with getting a rental, and go through all the stuff of being uncomfortable, of not having my own car that I enjoy. So we just keep on prodding along and ignoring it. I think that by and large, a lot of people in the viewing audience are most likely ignoring to some level anxiety or depression. And over time, that will prove problematic, and you'll have, you know, essentially the equivalent of breakdown. And so when we look at what Olivia did of coming into treatment, when folks come and present with anxiety, it's really about recognizing it's time to get in the shop. It's time to figure out, let's get under the hood and find what's fueling this. What is actually the problem? And people think it's just about stress or anxiety or one specific thing that keeps coming up over and over. And in reality, more often than not, it's interjects that we're carrying from, it can be from childhood, it can be from school, it can be from any number of things. And we develop a behavioral pattern that eventually becomes maladaptive and can be kind of self-destructive. And so through looking at anxiety, you oftentimes wind up uncovering relationship issues. You look at childhood experiences, you look at professional identity, you look at your own identity consistency, and we also recognize a lot of people aren't very good at having fun. You know, we get so driven and goal-oriented, and the idea of fun usually becomes partying. You know, everybody just kind of, you know, the doors blow open and we get a little nuts, and then it's like, wait, clean it up, back to work. Actual sustained interests and fun and hobbies really kind of tend to fall by the wayside, yet they're so important. And that's one of the things that we've kind of been working on, is trying to figure out what's interesting to you. I mean, because work has clearly fueled you and fed you and sustained you, but there needs to be more. And so it comes around looking at that. And obviously, like she spoke about, as I continue to ramble here, you know, it was getting some coping skills on board, recognizing the tenets that we've spoken about here several times, and that she referenced, you know, deep breathing. It sounds elementary, but to make sure that you're doing it right and in the right times and for the right reasons. That's the connection that we make. And then looking at other habits like getting good night's sleep, restful sleep, exercise, getting outside, the same things that I've said here. You're probably all sick of hearing it, probably hear it in your dreams when you're getting that good restful sleep. But those are really the pillars of mental wellness that we try to get everybody to integrate to their lives to some extent.
So waking up at 4 a.m. with catastrophic thinking and self-doubt is actually not healthy, is that what you're saying?
Depends. If
much of a depend to it.
If you're coming into the 300th episode, I mean, it might be a thing
that could
for
be
you.
right.
But that, I think, is an important thing, is that a lot of people with the pandemic, they were already at level 7.
Yeah.
This brought it to 10 and beyond.
Mm-hmm.
And so I applaud Olivia and a lot of my patients. And in fact, this is something kind of funny. Olivia and I have never met in person.
Wow. Oh my.
Because she came in during the pandemic when everything had shifted to telehealth. And we joke about, when we ever get back in person, how awkward is that going to be to actually meet after going through everything that we've been through in the course of treatment. But without telehealth, I can't imagine where people would be. Because,
More anxious.
Well, yeah.
Yeah.
And for some more dead. Because,
More dead, right? They wouldn't have made it through.
Right.
So Olivia, talk to us about, does this, the description that Dr. Nawalanic just went through, does that sound like you?
Yeah, I suppose that probably.
It sounds like me, Olivia. It's okay. You can say it sounded like me too, back in the day.
It's brought anxiety to 11.
Yeah.
To 11.
Right, exactly.
And it just feels like the pandemic has fed it. What do we say now to people? Olivia, do you have anxiety about getting back out into public? Are you vaccinated? Let me ask you that. I'm sorry, I'm being real direct here, but have you been vaccinated?
Yeah, I am vaccinated. I signed up as quickly as possible because I am trying to get out of my house. So,
Awesome. And so have you gotten out of your house?
I have. I've been fully vaccinated for a little over a month. And so I have made friends. Everyone's trying to make friends, it turns out. So talking to people is really easy now in public. But I've just been, happy hours. I bird scootered yesterday, just like little things I haven't really been able to do for years.
Does that feel better?
Yeah, I would say it's an improvement.
Yeah, good. And were you anxious to get out of the house? I mean, not because you wanted to get out so bad, but did it bring anxiety to you to think, I'm going to go out of a house without a mask on, I'm going to be around people, I'm worried about COVID. Did that come about too?
Yeah, I actually am getting ready to go back to work next week, and that makes me kind of nervous a little bit, probably just because I haven't really had to leave for anything that serious. So yeah, I'm a little bit nervous, but I hope that things can be a little more normal than they have been. I don't really know what that is anymore, but no masks would be fun.
I like what you just said. I want it to be a little bit more normal, but I'm not sure I know what that is anymore. That was perfect.
Yeah. I think that, not to limit it to her, I've heard an experience from a number of different people who have, after getting back out, and they come back home and they've had a kind of normalizing experience of being out and doing things like they used to do, like socializing, safely, of course. Coming home and having this kind of emotional, not letdown, but like a release, like almost a catharsis around just being overwhelmed with tears, and not sad tears, but just all these feelings of connectedness that have just been absent, and the realization of that. And I don't know if Olivia wants to talk about that experience, but I think it's very powerful and really kind of hits a lot of people in a very profound way.
Olivia?
Yeah, well, I actually joked, I think it was just a couple weeks ago, that anytime I do like some new social activity, I cry when I get home because I'm like so excited to get to like do fun things again. So, very relieved.
Yeah, tears of joy, tears of sadness, tears of joy as the pandemic hopefully continues to wind down. Jill, I bet our questions aren't winding down.
Yeah, we have a lot of questions, not a lot of time. We have questions that are regarding asymptomatic, but we also have some questions over here on topics. I'm going to start with those. Cindy wants to know from Olivia, when feeling anxiety, what do you do now to stop that feeling?
Typically, I will immediately go outside. I notice that like fresh air really helps me a lot, and then I'll go for a walk. I will breathe deeply while I am walking.
It works, doesn't it? I do that. It works, actually.
Yeah.
Shocker.
Yeah. Typically something like that. I try to remove myself from the situation, even if it's just for a couple of minutes, and then try to return to it with a different mentality that maybe is less panicked.
Yeah, I try to make sure that I put it out there and watch the train cars go by full of anxiety and say, okay, it went by me and I'm still alive. How's that working?
Angela and Stephen, their questions are, I think, are kind of similar. Angela said she went to her cardiologist yesterday, and the nurse says she will not be getting her vaccine, but doesn't say why. Stephen says, despite the scientific community, my son-in-law believes the vaccine will mess with his immunity and other diseases. They want to know what is happening up here in their noggin that makes them think that way, and how do you address it?
Yeah, have good luck on that one.
We'll be back in 20 minutes.
I mean, I think that if we're going to be honest, it's just fear of the unknown, which is the same thing that we had at the beginning of the pandemic. The difference is, at the outset of the pandemic, we knew people were dying from this disease. We knew that people were being hospitalized on ventilators from the disease. What we do not know or have not seen around the vaccine is those experiences. We hear people get, a little sick, maybe for a day, but I'll take feeling unwell for a day to get myself back to the type of experiences that we're talking about, of getting back to our lives and feeling a decrease in this random panic and anxiety and getting pummeled by every day another wave of anxiety and fear. And it's the one thing that you actually can exercise control over, making that choice. And, I've heard people who have a slight panic response once the injection's in, and when they start to feel a little weird, they're like, wait, I can't get it out. Oh my God. But just relax. We know this is part of it. You can expect that in a certain percentage of the population. Some have absolutely no side effect whatsoever. And so I think it's interesting to hear people more willing to roll the dice around a disease that we know has such significant deleterious perspective and possibility and potential, than taking a vaccine that we know the largest downside is maybe feeling like you have the flu for a day. And it responds to Advil, because I was one of the ones who got pretty sick, and Advil was great.
Same here.
So I'm proof's in the pudding. I'm pudding right here, I'll tell you. And I really enjoy having my life back. And as far as being told that you couldn't have the vaccine, that's medical grade question there. I don't know the answer to that. But as far as the fear of what this is going to do to your body, there's reputable material out there to review that will explain how the vaccine works. There are some great accounts on Instagram of people who are actually qualified medical professionals who break it down into layman terms, so you can understand how this thing works and what it does, and that this isn't some novel, strange technology that's never been used before. This is something that we're familiar with. There's a reason it got chosen, there's a reason it's being used, and there's a reason it's effective. And so I think the more that we can push away from either right-wing or left-wing extreme views on social media, and recognize, look at the people around you and the folks that you know that have gotten vaccinated, what's their experience? Because that's reality. All this stuff in the wings, it's not real. And the more that we try to lean into that, the further we are from our actual life and our actual, truth and reality.
Hawk, that was perfect.
Yeah,
Hawk.
I agree. Without knowing why they said you can't get the vaccine at the clinic, I don't have a good answer as to.
But does the vaccine jack with your immune system?
The vaccine, the only thing it does is improve your immune system and develop a specific immune response to that spike protein, i.e. to coronavirus, SARS-CoV-2, to protect you from those things, from blood clotting, from respiratory failure, having to go on the vent, from having to go to the hospital. So it protects you from all that thing. It doesn't integrate into your DNA, it doesn't change your chromosomes, it doesn't change your bodily makeup. It's very, very specific and very, very efficacious.
And to think that, just as a quick point, that as you look across the world and think there's this worldwide conspiracy of physicians and scientists to invent something that's COVID, hey, it's not a hoax, and then to have a vaccine become effective, no, it doesn't really kill people, and that we'd had to fake all those COVID tests, that is just, it is not possible to think that that can be true, because it's not true, and the vaccine works.
And with the nurse, it was the nurse saying personally, I'm not getting the vaccine. Not that you couldn't get it at the clinic.
You know what? People continue. There are healthcare providers. You know, we know.
Yeah.
We talk with folks, and and I'm sure we can talk with this about with Dr. Norman tomorrow. The number of people, even who work in nursing homes, who haven't been vaccinated yet, and despite watching all the elderly suffer and die from that, and then you think about that. Man, what is it going to take for people to understand that there are over 600,000 deaths when 30% or 40% of Americans have had it, and now we have 50% of Americans who are eligible to get the vaccine, and they are dying. So 600,000 to like zero. What kind of odds do you really want to have? And that's just the deaths from COVID-19. That doesn't include all the disability, the lung problems, the long haul symptoms, the lack of taste, the mental fog, and all the things we know occur. This is an insurmountable odd. There is no question about the efficacy and the safety of these vaccinations. Please, next question.
Did you want to wait?
Well, I was just going to say, and the fact that we are so fortunate to have the widespread availability of it.
Yeah.
I mean, that we are going to be so irresponsible to the rest of the world when we have it right here to get, where they would give anything.
We're wasting. It's expired.
Right. I mean, this is
like wait, we can't find an arm, and the vaccine we have is going to expire or has expired. That's just, oh my gosh,
Shameful.
It makes me. It just hurts my soul.
Yeah.
Amanda says that she was diagnosed with severe levels of anxiety. The diagnosis is GAD and health anxiety. And her question is there any way that I can treat this without medication? She said people, physicians and psychiatrists that she's been with are always pushing meds, and she doesn't want to be on medication.
You can absolutely treat anxiety without medication. In fact, the reality of anxiety treatment is that the medication simply takes the edge off the intensity of the anxiety when you're in that panic state. It's the actual getting in with a therapist and doing the work around the issues. So it's essentially like if your anxiety is a pimple, the medication is going to be the topical anesthetic that makes it not hurt so bad, but it's always going to return and be there until you finally squeeze and get out what's in there really agitating and stirring up what's going on underneath. And so that's what talk therapy does. And the coping skills that you integrate into your life, you know, if you really want to beat this, you will mindfully employ those coping skills and see the benefit almost immediately.
Okay, a couple of questions about asymptomatic patients that are in the hospital. One of them is, Bailey says, are the asymptomatic vaccinated COVID-positive individuals still able to spread COVID?
Yeah, great question. And Hawk, what we know is, again, the vaccine doesn't, it does decrease the odds you're getting COVID.
Yeah.
You'll still get it. The odds are strongly you're just going to be asymptomatic. Rarely are you hospitalized with it. So just to be clear, none of the people who are vaccinated are hospitalized right now because of COVID. They're hospitalized for something else, and then we found the COVID being positive on a routine test, and that actually could be because they could continue to shed it for a very long time, so who knows how long they may have even had it. But the point is they're not acutely ill from COVID. Could they still spread it to someone else? We know there's pretty good data, Hawkeye, that is actually decreased markedly too.
Yeah, I think we believe you can still spread it, but just to your point, it is markedly decreased the amount that you can spread. It is significantly decreased. So we believe you probably still can, because we don't have that exact answer in the published data, but real world data would suggest that your ability to spread the disease is significantly decreased. Also remember that everybody in the hospital, all the caregivers, are wearing eye protection and masks as well.
Okay, so I think we answered David's question. They're coming in because the active patients are coming in because they're having a baby or they've had a heart attack.
Or they need knee surgery, or they're having they had a fall.
Yeah.
And so Lindsay wants to know, on that point with the surgery, if you're asymptomatic with screenings, do you make the patients go home and quarantine before you?
Where are we today with that? I think it depends on the level of the surgery.
Yeah, I think level of the surgery, the surgeon, and also vaccination status. So vaccination status is going to play a big role in that as well.
If you're vaccinated, we have a greater tendency to move through and continue with the surgery than if you're not vaccinated. We're not trying to be harsh by that, by the way. We're not trying to criticize those who have not been vaccinated. That's actually just medically. We know if you've been vaccinated, even if you're positive, you tend to do just fine.
Yeah.
Okay, last question. Sydney wants to know, you talked about the Memorial Day weekend, and CDC said party like it's 2019, not 1990.
Well, they didn't quite say
But,
Yeah, let's
but
walk that back a little bit.
not really quite there.
she wants to know, does that
about
include,
Prince.
like, do you still need to take precautions if you're, like, flying and blah, blah, blah? What does party like 2019 mean?
Yeah, well, it doesn't mean party like it's 2019 if you're not vaccinated. Because if you're not vaccinated, you can't. That's actually what they're saying. They're saying if you've been vaccinated, you can go out and do things you would have, but like it was 2019, but not if you're not vaccinated. And remember that the rules about flying and traveling have not changed, vaccinated or unvaccinated.
I would absolutely wear a mask and eye protection if I'm traveling, whether it's bus, train, plane, doing all those things in those other larger settings, such as an airport, where you're going to be around people. Continue, as Dr. Nawalanic said, do things safely. Continue to try and distance as much as possible, because you may not always know that somebody is vaccinated or unvaccinated. So certainly try to protect yourself, even though you're vaccinated and are going to be greatly protected from the whole spectrum of disease of COVID-19 and the ability to spread the disease if you get it. I think overall it's just going to be important to continue those safe practices right now.
Tomorrow, KDHE Secretary Dr. Leah Norman is back with an update on the impact from the loss of public health workers across the state and the urgency to support mental health among healthcare workers everywhere, including this program and including people like our guest today. Hey, we know at least one person who will be watching, and that's 4-year-old Celeste, also known as Cece. She has a huge crush on Dr. Norman. Cece will talk about that. And she's also a big fan of the morning media update. That's a good plan. Her mom, Ashley, says Cece insists on listening to the morning update as she walks to daycare. We will want to give a special shout out to Cece tomorrow when Dr. Norman is here with us. Team, final thoughts. We'll start, Dr. Nawalanic, with you.
I'd just like to encourage everybody to try to be as safe and responsible as you can be around not only vaccine and COVID, but also your mental health and wellness. We have Mental Health Month, which is Awareness Month, which is May. We're in this right now. But it's not limited to 1 month. It's great that we get to shine a light on it like this. But, for example, we're doing actually a partnership with the Royals, and we will be having Mental Health Night Day at the K on July 27th. There will be some special mental health themed tickets available. I think they're doing a giveaway for like the 500 seats. It's a hat with the green ribbon on it. So very exciting to see the Royals being willing to take up the torch and kind of shine their own light on it at another time that, a month and a half later, 2 months later. So very exciting, but, appreciate Olivia being willing to share her story and, try to reach out. I think that's the importance, and take care of yourselves and take care of each other.
Olivia, I'm coming back to you, but first, Hawkeye, final thoughts?
Yeah, I want to echo Dr. Nawalnik's points. Mental and emotional health is so vitally important. We have resources. Please seek those resources out. A lot of times it can just be therapy. Other times it's a combination of medications and therapy. But seek out those resources and really get help for yourself. And, heaven forbid, but for the next 300, hopefully I will look as dapper as Dr. Nawalnik does over here. He certainly classes up the show. So.
And not like he just got out of bed.
That's right.
Olivia, final thoughts from you today.
Yeah, I think that it took me a long time to finally be ready to make the kind of effort that I needed to make to change how I felt. But my life has changed, and I feel like I've realized anxiety does not have to run my life. So I think that if anyone else is feeling like that, I can't believe I'm about to say this because I get really mad at people when they say it to me, but it does get better. and talking to someone really helps.
Olivia, you have been both brave and you have faced that anxiety to be on this program, and I want to thank you. It has been wonderful. You're welcome back anytime. And hang in there, and you've made us all a little less anxious today. Thank you for doing that. And that statement you made, I want this to be a little more like normal, but I am not sure I know what that is like anymore. That was so right, and so right for many of our listeners. 300 episodes. Who would have thought? There will be a 301st, and there are going to be some more. But someday this will end. The sooner the better. And we really can figure out what life is like. And we won't have to remember or think we can remember what it was once like. We'll experience it again. It takes all of us. It takes vaccination. And it's still following those rules of infection control. So until then, however many more, we'll be here. But in the long run, what we really want, we want you to be vaccinated. We want you to be safe. We'll see you tomorrow.